To have you back. Now, Gauteng has over 74,000 active COVID-19 infections. The healthcare sector says it is feeling the burden at this point as hospitals run out of beds and oxygen. Now, residents are being urged to follow precautionary measures, this to try and curb the spread. To discuss the province's plan to flatten the curve, we're now joined by Lesiba Malotana, of course, from the Gauteng Health Department. Thank you so much for joining us, sir. And that is the question. I mean, what is the government's plan, particularly the Health Department, to flatten the curve in the province?
Good morning, Tumelo, and good morning to your viewers. Thanks. And I think, Tumelo, you summed it up in your introduction there, that the Gauteng is in the middle of a third wave. We are severely under pressure, and I think we must express that sharply. Of course, the fight of the pandemic can't be done by government alone. The citizens are urged to do the best they can in terms of the non-pharmaceutical intervention. But as far as government and the Gauteng Department of Health is concerned, ours is to create additional capacity and continue, of course, to educate and train and urge all the citizens to comply with the non-pharmaceutical and the interventions that are in place. Ours is to ensure that should people get to a point where they need a hospitalization, we're able to provide that. And that's the work that we're doing day and night in creating additional capacity and bringing additional HR to assist us with the fight against the pandemic.
And with that being said, I mean, when we speak about timelines, when can we be assured that you will be satisfied as the health department, your healthcare workers will also be satisfied with capacity in terms of not only beds, but also manpower here when we talk about nurses as well as doctors? In terms of timelines, do you know when you can say, you know what, for sure, we have everything under control in both the public as well as the private hospitals that we're seeing?
We appreciate that we are competing for the finite resources as far as HR is concerned. There are only so many nurses and doctors. There are only so many clinicians we are all fighting for, both public and private. So our system, on a daily basis, we continue to recruit. We have agreements with private nursing agencies that are supplying us with private nurses. We, as a Gauteng Department of Health, also agreed on walk-in applications. So if there are clinicians sitting at home that think they can contribute and assist, they are more than welcome to approach their nearest facility, and we will be. In fact, we are urging those that are out there to come to our facility, and we can enter into a short-term contract for the purpose of fighting the pandemic. So on daily basis, we are aiding staff. We, of course, you will know the bringing on of the National Defence Force in the past couple of days. We have signed an agreement with Solidarity Fund. They are bringing additional 250 nurses. Of course, there are not 250 nurses readily available. They are on a process of recruiting, and as and when they bring, our target is to then say, by the middle of next week, having activated additional 550 beds towards the fight of the pandemic. So it's something that we do on a daily basis, aiding numbers, and we urge the clinicians and professionals that may be out of work, that think they can assist us, and of course are registered appropriately, approach us for assistance in terms of fighting the pandemic.
Yeah, I think that's an answer that definitely, you know, the likes of Dinosa would appreciate, because they're lamenting, Mr. Malotana, that they're currently overburdened. There seems to be no capacity for them to function or work in the environment that they're in, currently under this third wave. They're even further saying that there seems to be no staff morale. And as soon as I hear, you know, that members or rather workers are saying there isn't staff morale to conduct their work because not only are their colleagues dying, but they're also seeing patients die and there isn't enough, resources to assist. It then begs to question, is the quality of the work by the healthcare workers then enough? Should it be questioned if indeed there isn't any staff morale? How do you then respond to some of those concerns by the likes of Dinosa?
Tumelo, Dinosa and other organized labor were quite correct. You recall, Tumelo, that the health workers have not had a break in over a year. They've been at the forefront for over 14, 15 months without a break. So that the morale is expected, as they are all humans, they to be exhausted, tired, demotivated, and of course, with a number of deaths, and including amongst their colleagues, it's something that psychologically will affect them. But where we are sitting, we are saying if we add more staff to assist in the fight against the pandemic, there will be more. Of course, that will assist and allow them to take more rest. And we also continue to provide psychosocial support for the staff, not knowing fully well that they themselves have been infected, knowing that fully well that they have lost their own colleagues and of course family members, they are not living in a vacuum. So we fully appreciate that. And once again, we also want to take it ahead of for their consistent fight, being in the forefront of the fight against the pandemic day in and day out, something that we don't take for granted. And we want to sincerely convey our appreciation for the work they continue to do.
You mentioned earlier on as well, Mr. Malotana, that government alone cannot fight this third wave in Gauteng, almost giving an impression there that also human behavior, the South Africans, the citizens that reside in Gauteng have a responsibility to assist not only government but themselves and their loved ones here, just in terms of flattening the curve. In terms of messaging and communication, how have you intensified that aspect to further just reiterate the messaging around vigilance, complying with the regulations? We've heard it before, but it seems that the numbers, the statistics are telling us that it's a message that you cannot give up on, constantly communicating. Where are you with that?
Thanks, Jumela. Look, we are cognizant of the fact that our citizens might also, to some extent, be COVID fatigue, but it's not something that we can afford now, given where we are in the numbers and the pressures. So our messaging has been consistent. Non-pharmaceutical interventions are very simple. It's you wearing a mask, you social distance, you sanitize regularly, and you only move when it's necessary to do so for essential services for the purpose of work and getting essential items, and other than that, everybody else would then be self-quarantining, for lack of a better way. So as far as that is concerned, it's something that we continue to reiterate, but we also urge the citizens to come to the party, but equally so, that those that are eligible for vaccination, as you would know, that the real battle will be about the sooner the larger population is vaccinated towards herd immunity. So those that are currently eligible for vaccination, we urge them to avail themselves. Currently, of course, we're doing teachers, as you're aware. We're doing health workers. We've done 92% of the health workers. We urge those that remains to be vaccinated to come and vaccinated. And, of course, the over 60s that are eligible. And in Gauteng, we went against the grain and said anyone who is eligible, especially the over 60, can walk in any vaccination site, they will be vaccinated. So a combination of all those behavioral issues and getting access to vaccines as and when people are eligible will get us over this. And that's the messages we will continuously preach.
All right. Gauteng Health Department's Lesiba Malotana, thank you so much for making time for us this morning.